Good afternoon, everyone, and thank you so much for joining us here today. Alberta, like other jurisdictions, is facing unprecedented pressures on our healthcare system, leading to growing strain in emergency departments and hospitals across our entire province. Our primary care providers are also under strain. Family physicians and primary care teams have taken the brunt of the pandemic for 2.5 years, and like all of the healthcare professionals in our system, they're tired. Many practices were impacted by the drop in patient visits early in the pandemic, and some are still suffering. At the same time, patients are coming back to seek healthcare services, including many who have deferred care over the course of the pandemic, so their needs are greater than they might have been otherwise. We've had problems with access to family physicians long before COVID, but as with other issues, the pandemic has made them worse and made it more urgent for us to be able to act on them and act now. We need to increase the access to primary care, and this is especially true in rural and remote areas of the province and for Indigenous peoples. And we need better integration between primary care and the rest of our health system, as well as community-based social services. And we need to act urgently to stabilize and reinvest in primary care right now, while also starting the work to design a vision for the longer term. And that work is underway, and it's my top priority as we head into the fall. Let's be really clear at the outset. We don't need better family doctors or nurse practitioners or other healthcare professionals. We have the best in the world, mainly because we train the best in the world. But we do need more of them, and we'll keep recruiting them as fast as we can, but we also need a better system for them to work in. And we need that for two reasons: to add capacity and get more Albertans connected to a regular primary care provider, and to help keep us attracting more doctors and more nurses to our province. Because the truth is, more and more doctors and other professionals want to work in a different kind of system than the one that we have. Like the rest of the country, we're facing a growing shortage of family physicians, in part because new doctors and residents are not choosing family medicine, and we have to change that. It is the bedrock of our system. And the problem is not necessarily the work. The family doctors I know are as committed to their patients as ever. They tell me their practices are incredibly rewarding, and rural doctors in particular say they never choose anything else. The issue is the model that we've constructed that, quite frankly, for the most part, hasn't changed in decades. The model of independent practice, the way they're paid, the integration, or quite frankly, lack thereof, with specialists and the rest of our healthcare system. But we have the foundations in place for the kind of primary healthcare system that we need, and a lot of good work is underway, including shifting to team-based care, using more virtual care, more access to pharmacists as primary healthcare providers and as part of the team, and more nurse practitioners in primary care. We need to build from our existing assets, including primary care networks, PCNs, and make meaningful changes that will further strengthen our primary care system. And at the core of the process, we need to listen to family physicians, nurse practitioners, and other allied health professionals. We have leaders in their field in our province who are already working in new models that work better for patients and for the long term. We need to move those changes from the edges of our system to the core and meld them with the best practices from other jurisdictions. And we need to do this together. And we need to engage frontline family doctors and primary care teams to focus on the right priorities for change and design solutions that will work for them and for Alberta patients. The goal of this project, MAPS, is to provide recommendations to move us towards 5 main goals. First, access. A system with the capacity to offer every Albertan access to timely, appropriate primary health care from a regular provider or team. Second, integration. A system where patients have seamless transitions to other health, social, and community services. Third, a system where every patient gets high-quality care. And that should go without saying, but quality just doesn't happen. It has to be defined, it has to be measured, and we have to have a system that focuses on delivering it. The fourth outcome is a patient-focused, having Albertans and their social support networks as meaningful partners in achieving their health and wellness goals. And the final outcome is culturally safe and appropriate care, a system where First Nations, Métis, and Inuit people have access to high-quality, culturally safe care that is designed and delivered in a way that respects their unique needs. To help achieve these outcomes, 3 advisory panels are being established to identify improvements in the short term and, quite frankly, to set a vision for us over the next 5 to 10 years. First, a strategic advisory panel will be co-chaired by Dr. Brad Baylor and Dr. Janet Reynolds, who are with me here today. The panel will be made up of local primary healthcare leaders and experts and will recommend an overall strategy to improve primary healthcare in our province. Dr. Baylor is a physician in Sylvan Lake, where he practices comprehensive family medicine, including obstetrics, hospital care, geriatrics, and palliative care, while working with the healthcare team at the Sylvan Family Health Center. He's currently the chair of the Primary Care Alliance. The other co-chair, Dr. Janet Reynolds, is a family physician at Crowfoot Village Family Practice in Calgary and the medical director for the Calgary Foothills Primary Care Network, or PCN. The second group will be an international expert panel made up of national and international experts and co-chaired by Dr. Jennifer Jenga and Dr. Richard Luwanzuk. This panel will inform the work of the Strategic Advisory Panel. Dr. Jenga is a CEO and founder of Canada Home Care Group. She's an Edmonton-based physician with experience in several countries, including South Africa, Canada, Australia, and New Zealand. Dr. Jenga has a special interest in primary care, public health, Indigenous health, and maternal and child health, and she has worked with vulnerable populations, including seniors, refugees, and Indigenous communities. Dr. Richard Luwanzuk is the Senior Medical Director for Health Systems Integration for Alberta Health Services. Prior to that, he was the Senior Medical Director for Primary Health Care for AHS, a position he held for 10 years. Dr. Luwanzuk is currently a Professor Emeritus at the University of Alberta and still co-chairs the Department of Medicine Working Group on Social Determinants of Health. He's actively involved both nationally and internationally in areas related to primary care, health system, and primary care and health system integration, and they're both with me here today. The third group will be an Indigenous panel made up of Indigenous health experts and leaders to ensure Indigenous voices and wisdom is integrated into the MAPS work. There will be a particular focus on addressing challenges Indigenous people face when trying to find a family doctor or other primary health care service provider. The MAPS work will aim to address access issues faced by First Nations, Métis, and Inuit people, making sure they are provided with high-quality, culturally safe care. Trish Merthieu-McCurdy, also with us here today, will be one of the co-chairs on the Indigenous Advisory Panel. Trish is an Assistant Deputy Minister in my department, and she'll be dedicated full-time to advancing the Indigenous stream of the MAPS work. She's been with the Government of Alberta since January 2016, and prior to that, she held senior executive positions with Health Canada and Indigenous and Northern Affairs Canada. The appointment process for the other panel co-chair will be completed in the near future. Now, looking ahead, this work will be a team effort. Alberta primary healthcare leaders are included on the panels, embedded throughout the work, and practitioners across our entire health system, including the Alberta Medical Association, will be actively engaged. An innovation forum will be held to gather panel members, stakeholders, and those involved in primary healthcare to discuss solutions to barriers and highlight international and national innovations. A final report with a recommended strategy to modernize Alberta's primary healthcare system will be delivered in the spring. As we modernize and strengthen primary healthcare in Alberta, we'll improve the health system overall and help ease the pressures on our hospitals. This work is about building on primary healthcare foundation that already exists in Alberta to create a system where everyone has access to a family doctor or primary healthcare provider, no matter where they live in our province. Strong primary care is the foundation for a high-functioning healthcare system. It's essential to the capacity of our overall health system, and it's essential to the health of Alberta patients. And it's, quite frankly, it's essential to the health of family doctors and our primary care professionals as well. We need to recognize the incredible dedication of family physicians in Alberta, of nurse practitioners, and of all the professionals, healthcare professionals, who have worked during these very challenging 2.5 years. And we need to say to them, we know what you've been through, and we know it wasn't easy before. So we're going to renew and reinvest in primary care to help make primary care practices viable and rewarding for all the people who practice in it today, and make it attractive to the next medical student or nursing student choosing how to spend their career. We need more of them to choose family practice and primary care, and to choose it here in Alberta. We need to stabilize primary care and address the impacts of the pandemic and fix structural problems that have been accumulating, quite frankly, for decades. Now, all of this won't be done overnight, but I can tell you that we will listen to our primary care professionals and recognize the problems that we're facing and make real changes to fix them. And the ask of this panel, and recognizing it'll be challenging, is for them to come forward with solutions in the short term, this fall, that we can look forward to implementing very quickly to address the challenges we're facing now, while at the same time setting a vision for our province. So once again, thank you so much for coming to join us here today. I'm excited about this work. It's a core component of the work we're doing to fix the healthcare challenges that we're facing as a province. And I'm so thankful to the people behind us who have agreed to take their time, their talent, and their expertise to lead these panels and fix our healthcare system. And with that, happy to take questions.
Thank you, Minister. We'll now begin the question portion of our avail today. We'll go first to the phones. Operator, if you want to put through the first caller, we'll take one question, one follow-up.
CBC. Hi, Minister. You've just said in your remarks that you need to take action right now to improve this model. If I'm a family doctor looking at this today, and I'm already telling you some of the tangible problems that are occurring in family medicine, and seeing your government appoint yet more panels, perhaps I'm thinking that this looks like you kicking the can down the road from taking any meaningful steps or investing any money. How would you respond to that kind of response?
So thanks for the question. We are investing money now. I was very pleased that we were able to reach a tentative agreement with the AMA, which is out for ratification at this point in time. Part of that agreement is about stability, and particularly stability for our family practices. It's about partnership. It's about innovation, and part of that includes a stability for primary care networks, an additional $40 million into primary care networks to be able to help the process of right now. We also are working very hard because we understand that one of the challenges that's being faced, people can't find family doctors, or family doctors can't share the load with others, is we don't have enough people providing the service. So working very hard, not only with the medical schools to be able to, how do we increase the number of spots that we have, so we can train more of our own, but leveraging immigration and shortening the timelines for certification, and getting more doctors in the province. As indicated before, we have more doctors than ever working in the province, but the reality is we don't have them all in the right places, and we're not keeping up with the increased demand. So leveraging our immigration pathways to be able to get more doctors, and we've had some success. So, for example, in Lethbridge, we've had 17 new IMGs who have committed to move to Lethbridge and family practice, and that will help. But we also recognize that it's not just about getting more people in, and this is and supporting PCNs right now, is that we need to look at other solutions and other ways to come at this, and quite frankly, learn from other jurisdictions. We know when we look at rankings for different countries with dollars into the healthcare system and health outcomes out, typically Canada ranks 11 or 12 depending on what year you're looking at the rankings. US ranks below us, but it's not just about the American way or the Canadian way. Quite frankly, there's a dozen other countries around the world that are doing this better than we are, and we need to learn from them, which is the purpose of the expert panel. What are other ideas that we can use? So this isn't, we are acting now, But we also know we need to do more to transform the system. So part of the work the panel will be doing is, going out, looking at what's happening around the world, what can we do differently, how do we transform our system, and focus on primary care, community care, home-based care, how do we integrate that, how do we make it easier for family doctors. And I guess my last point on this, it's as important how we do something as what we do. Because this really, quite frankly, is about partnerships. We as a government don't necessarily have all the answers, and even if we had, the solution that we think is the best thing since sliced bread, but no one agrees with it, you never can implement it. So part of this is actually to build an implementation plan with people who are in the trenches, doing the work day to day. What can we focus on at the highest priority to get the results that we need? It's going to take time. These problems weren't created over months or weeks. Quite frankly, many of these issues, particularly in rural areas, they've been around for a long time, even pre-COVID. But COVID highlighted them. It's exacerbated the problem, so we know we need to address them. So we are taking action right now to address these issues in terms of increased investments in primary care, and we know we need to stabilize the system. And the work that this panel will be doing is looking at what are the solutions we can implement quickly. Quite frankly, and I'm asking them, which is a challenging feat, quite frankly, and I thank them very much for doing that, to come with solutions like, okay, what quick hits can we get this fall, but also a vision for long term that we can work together and transform our systems and get some of the results that many other countries are getting with a focus on primary care and actually better healthcare outcomes at a lower cost.
Thanks, Janet. Do you have a follow-up?
I do. It seems like some of those investments you're referencing, though, are contingent on doctors voting in favor of that contract or the AMA, which they have not done yet. And I'm hearing mixed reviews from doctors about this proposed contract, particularly from family doctors who say it does not go far enough to recognize the costs of running an independent practice. So how confident are you that this proposal before doctors will pass, and why?
So again, we worked very hard with the AMA on this agreement. And it's a choice for doctors to make, but the key themes, and this agreement is fairly complex, but it's really about partnership, working together. It's about stability, so investing dollars into areas like family practices and business continuity plans, and quite frankly, it's also about innovation. And this is one thing that I'm very excited about, is that working together to look at different models, different pay models for doctors to ensure that they can have viable practices, not only in the short term, but over the long term. And we get our pay models right. There are new doctors who are coming in, who are graduating, who quite frankly don't want to set up their private practice. So is there another model that we can put in place for them to be able to continue to work and provide services in the field? And we need to work together. So this agreement, worked with the AMA, very diligently over the last 6 months, and thanks to the bargaining teams who went through a interest-based process to do that, and thanks to Dr. Warren and myself who were personally involved, because we know we need to work together to solve the problems. Believe that this agreement delivers on that. But again, at the end of the day, it's the choice of doctors around the province of whether they want to accept it or not.
Thank you very much. Operator, can you put through the next caller?
Madeline Smith, Edmonton Journal.
Hi there, Minister. What's your understanding of how bad the situation has gotten with access to primary care and access to family doctors? You mentioned some of the issues that are happening, but, I know the doctors have been bringing concerns to you for some time. So how would you characterize, the problems with access at this moment?
Yeah, it's so. As I stated earlier, we do have an increase of doctors in the province. They're not necessarily in the locations that we need them, or in the specialties that we need them. And quite frankly, Alberta is not alone. This is a issue that's across the entire country, and this is an issue around the first world in terms of getting access to care. I don't have the exact details on it, but we can get that for you in terms of the increased number of docs. I have been on tour throughout the summer and early fall in rural Alberta. We know that this issue is quite frankly more acute in certain areas of the province, where there's a challenge finding doctors. But there are also pockets of success, right? So you look at St. Paul, for example, 7 new doctors in the last 6 months. Lethbridge, where we've had challenges there, but we've been able to recruit an additional 17 have committed to come to Lethbridge. So we are making progress, but the reality is it's not just about getting more staff to be able to provide the services. We need to look at different ways to be able to provide that care, and how do we transform our system? And quite frankly, that's what the work of these panels will do.
Thank you. Do you have a follow-up?
Yes. I'm also wondering why this work is being introduced now. I mean, obviously we are in a political time where a new leader is about to be appointed, and the work that you're asking for asks for recommendations in spring 2023. So, are there guarantees that the political environment won't kind of eat up this work, or that this will actually be able to have some continuity through, the changes that are coming, not least of which is, an election next year, likely?
So I'm confident that this work will be valuable regardless of who's in the chair, because it's necessary, right? This is when we talk about, the healthcare challenges facing Alberta, and primary care is one of the issues. It's facing the entire country, and regardless of who is in the chair, we're going to need to address that. And so this work, providing input from voices across the province and from different sectors, Indigenous and Métis voices, getting input from primary care networks and family care doctors and nurse practitioners, all of this will be valuable. And I appreciate your comment saying that the final report will be coming out in the spring. But if there's things that we can act on earlier and now that makes sense, then we're going to do that. And regardless of who is in the chair or what government is moving forward, quite frankly, they're going to need to address this issue, and we're not going to wait. We're going to move forward.
Thank you, operator. Can you put through the next caller?
Adam Toy, Global.
Yeah, thanks for taking my questions. I'm just wondering about the panels and the scope of them. Are there any, would changes only be limited to, for example, the health ministry, or if the panels suggest, say, some monetary benefits or incentives, would that be considered? I'm just wondering what the scope of the ideas could be, if there's any sort of guidance on that for the panels.
That's a great question, and we spoke about that, quite frankly, yesterday, right? And from my perspective, the scope needs to be fairly broad. We understand that there's social determinants of health. So how does that impact the delivery of healthcare, and particularly primary care? And are there additional supports that are needed to actually transform our system in that regard? Now, it will initially take a healthcare focus, but quite frankly, as we identify other issues that may have a cross impact on that, then we're going to have to, as a government, and I'll have to go to my colleagues to say, okay, this has a cross impact on health, so how can we address this issue? Are there other programs that we can put in place? And part of that, this is why I indicated there's both a short-term component and a longer-term component of that, because some of the ideas that may come forward, we may not be able to change that overnight. It may take a different approach, a different level of assessment. So part of what I've asked the panel to do is not only look at what are some of the quick hits that we can do within our current system, or slight modifications or changes to our system that we can try or pilot right now, or make a full system change. But then what's the vision for the future in terms of providing that service that gives us an opportunity or a roadmap to be able to change that over time, which may very well include different departments.
Thanks, Adam. Do you have a follow-up?
Yeah, on a different topic, Edmonton Public Schools, 10% of them more than 10% of them are experiencing respiratory. Earlier in the week, that school board superintendent said he'd prefer that if the province report the public health info rather than them having to do it themselves. School districts across the province have dropped any sort of absence reporting following this summer's news and changes. I'm wondering if the province, or if you're in talks with AHS to release that information so that information that an infectious disease doctor that I spoke with called extremely useful in forms of allowing parents to make informed decisions about their own and their children's health choices.
Yeah. No, thanks for the question, and I appreciate that. We are moving into an endemic phase with COVID. It's still with us, and we need to manage that. So we're using the tools that we manage with flus that we've had before, which is when you get a 10% increase of absenteeism due to a respiratory virus. We actually advise the parents associated with that, so they know that this is occurring. We understand that there's a number of schools in Edmonton that are impacted, and I think all of the ones, roughly 80 to 90% of the ones that are impacted in Edmonton or that are impacted are all in Edmonton at this point in time. I haven't had a conversation yet with my colleague, the Minister of Education, about different approaches. If there's concerns about the ability of schools and or school boards to be able to work with AHS in regards to how do we manage the outbreaks from a resource standpoint. I haven't had that conversation yet, but we'll do so.
Thanks very much. That's all the time we have for today. If you have any follow-up questions, please feel free to reach out to our office. Thanks.
Great. Thank you. Thank you, everyone.